Hello, Dimi. How you doing?
Hello, how are you?
I'm very
Thank you.
good. Okay, it's a pleasure to hear you again. We are here to talk a bit about your visit in Poland this year. It's gonna be first time in Poland, or you've been here before?
It, it, it's going to be the first time in Poland, and we're very excited to visit the country and get to meet the people and also learn a little bit more about your culture while we learn, all of us, a lot of good information about advanced physical therapy techniques.
Good to hear. I think the conference and the other people who are gonna be there too, they're gonna have very interesting things to tell. So I'm looking forward to this conference. But Dimi, could you introduce yourself a bit? I'm very familiar with your person and your background, but some of the people maybe would like to hear something more about you.
Sure. I am a physical therapist and a medical doctor, and I have studied and researched the area of manual physical therapy since the late 1980s. In the mid-1990s, myself and my business partner, Dr. Dimitriosem, who will be joining me in the trip in Poland, we formed hands-on seminars where we started teaching courses in advanced manual therapy. And we teach these courses around the world and have also performed extensive research. Besides my physical therapy and degree in medicine, I also have a PhD in physical therapy, as well as a doctorate of science in clinical electrophysiology, since the area of clinical electrophysiology can also provide very valuable information to the physical therapist, especially when it comes to the area of differential diagnosis of various problems.
Oh, that sounds really spectacular. It's a lot of titles, and I think that lots of us would like to have that big experience like you. You've mentioned something about your PhD. Could you tell us something more about it? What was the topic you was researching?
Sure. I did a PhD in physical therapy at New York University, and I looked specifically on a variety of interventions for patients with osteoarthritis of the knee. You see, knee osteoarthritis, especially in populations that are kind of obese, and in the United States we do have a significant obesity problem, requires very special attention. So I looked at a variety of approaches for the treatment of knee osteoarthritis.
Sounds interesting. And lots of these different treatment techniques, I think you're teaching also on your MCMT seminars, yeah?
That's correct. You see, when we developed the Mastery Certification in Manual Therapy program, we wanted to develop a program that can have immediate clinical applications. And instead of being a program where you just learn some theory, to really bring the clinic into the classroom. Many times people will go and take a specific course. They're going to learn maybe one technique. Let's say somebody learns a Spiriax technique, or somebody learns a Mackenzie technique. You know, they spend several days, they learn one single approach, and then every single patient that they see subsequent to learning that approach is being treated with that technique because simply this is what they know. But that's not really what is the most effective way to approach a patient.
Exactly.
A patient should not fit the model that you know. It should fit. You should fit your model to the patient's needs. So for that reason, we created what is called a clinical toolbox in other words, a box with many different manual therapy approaches that can be applied to the patient based on the specific needs. And I'll give you some examples. In our programs, we teach myofascial trigger point therapy, we teach strain and counter strain, muscle energy technique, mobilization and manipulation both for the spine and the extremities. We teach advanced neuromobilization and, of course, proprioceptive training, which is very, very important in the realm of manual therapies.
Yeah, it's very interesting, and you know, it's also my experience because I finished lots of courses, and like after any of these methods you mentioned, you know, you're coming back to your clinic, and actually you have lots of techniques, but you don't know how to use them because every patient is different, and sometimes you need something more than like Mackenzie techniques, manual therapy techniques, and or any other method, and they don't give you this like clinical reasoning. So I think it's very interesting. And could you tell us something more about some of the techniques you teach them about, for example, trigger points?
Sure. So for example, the presence of myofascial trigger points is something that many practitioners ignore, or if they have been taught how to treat a trigger point, most times they will treat it just with a massage, or they will just do something in the form of like Chinese techniques like shiatsu or something like that, which is not truly the most effective way to treat a myofascial trigger point. You see, a myofascial trigger point is an actual entity, a pathophysiological entity that is being contained inside a skeletal muscle, and that entity needs a very direct and specific treatment. There are many methodologies that can be utilized to treat a myofascial trigger point. Some are more direct, some are less direct and more passive. Nevertheless, any of these techniques can be very, very effective. Also, as part of the repertoire of the variety of the techniques that we use, we may also use dry needling technique with the use of a flexible acupuncture-like needle that can be utilized to inactivate and resolve the myofascial trigger point.
All right, and you teach also on your seminar how to do the dry needling, or you show the different kind of techniques?
Well, we use a variety of techniques. The dry needling seminar is a separate seminar. It's not part of the introductory myofascial trigger point course. Someone to take the dry needling course, they must have first complete first the trigger point therapy general course, and then of course they can take the dry needling course.
All right.
It is more of an advanced class, the dry needling course.
Okay. I would like to talk more about other techniques also that you teach at your seminar, and could you tell us more about them step by step, let's say about these muscle energy techniques?
Sure. Look, basically, when the way we teach the class is very similar to the way that you evaluate and approach a patient. Because as I said, our purpose is to bring the clinic into the classroom, to bring the reality of the clinic into the classroom. So when you see a patient, you go through a specific evaluation protocol based on the patient complaints. And we start our programs with teaching you this evaluation protocol. So based on that evaluation now, let me give you an example. Let's suppose that our patient has more of an acute problem. If the patient has more of an acute problem, a more appropriate manual therapy technique to use would be specific components of muscle energy technique, perhaps some strain counter strain, and very mild myofascial trigger point therapy. When the patient is in a more subacute type of phase, then we can definitely use myofascial trigger point therapy to address the muscle component. We can utilize some of the more aggressive muscle energy techniques, and then we can start introducing mobilization and manipulation techniques. And when we move the patient into a more chronic type of stage, then we can use our manipulation techniques, and we can definitely introduce significant neuromobilization type of techniques to break down any neural adhesions on the neurofascial tissue. And of course introducing proprioceptive training, which is extremely important, because while all these other techniques that I just mentioned can work as a curative techniques to cure the problem that the patient has right now, proprioceptive training is a technique that helps to prevent future reoccurrence of the problem. So then our techniques work in a spectrum, in a continuum through time, where you start, depending on your patient, from the more acute appropriate techniques to the subacute stage appropriate techniques, and then to the chronic stage appropriate techniques.
It's good not leaving patients after the treatment without help that could improve them and make the problems not coming back. So I'm glad that the course is not only the treatment part, but also helping the patients to get back to life for a longer period of time.
Exactly.
And could you also tell us something, because I heard and I know that you preparing some new improvements into the teaching system. So they are on a like a very extended stage, or how it looks like?
Well, there are various ways that we implement during our teaching. We have the live programs and courses that we are working with you right now in bringing in Poland. And furthermore, we have developed what is called a hybrid program technology. And through this hybrid program technology, people will be able to take not only a live portion of the program, but they will be able to enhance their knowledge and expertise via an online support component of the program. And that online support component of the program potentially could be also with your help in the Polish language, so people can who do not feel 100% comfortable with the English language, they can find solutions and understanding in the Polish language.
Good. All right, and lastly, what would you like to tell us, and how would you like to convince some of the people to take part in CMT?
You see, hands-on seminars has been a leader in the area of continuing education since the mid-1990s, now for 20 years. And throughout time, we have certified tens of thousands of people around the world. And we would love to have the Polish physical therapists join our programs and become certified to join the thousands of other physiotherapists who have received advanced training through our organization. At the same time, the important thing in physical therapy is for the profession to achieve a sense of autonomy. And the sense of autonomy in practice is not being achieved only with the knowledge of one specific technique. It comes with taking first the responsibility, the therapist taking the responsibility to truly learn not just techniques, but also learn how to properly diagnose the patient and how to properly do differential diagnosis on the patient, utilizing a variety of methodologies. That brings the skill of the physical therapist to a totally new level, where he or she can totally and fully manage the patient in its entirety. And that is a very important component that is part of our program as we do our very best to prepare the physical therapists to become autonomous practitioners. Because that is really the future of the physical therapy profession. And we have to step ahead and do the future and live the future right now.
Yeah, all right. So, Dimi, thank you very much for your time, and that was a very interesting interview. We're looking forward to see you in Poland and to take part in your seminars. I think I found it very interesting and efficient in the practice. So, see you at November.